Okay, we're live.
Hi, everyone. I'm Christine Moutier from the American Foundation for Suicide Prevention. And today I'm with Jackie Padilla from NowThis, and we're focusing on coping and thriving today.
Yeah, I appreciate you having this conversation with me. I think this is a time where everyone is being very mindful of their mental health, and our audience especially wants to talk about how do we cope with it, and we're all in this deep reflection mode. As I know I am, and one of the questions we had from our discussion last week with you was, how do we cope with it first internally when we feel these emotions of anger or sadness? Is it okay to cry and yell, or any of those kind of what we consider maybe extreme emotions on a situation not necessarily like this where we're in isolation?
Yeah, I'm so glad you're bringing this up because I feel like it's something we can actually practice now and take with us for the good of our lives and our health moving forward. Like feelings and human emotions are real and exist for a reason. And I think, we've been kind of socialized to figure out ways to avoid them, to brush them under, to almost like use denial, to say, hey, if I don't pay attention to it, it doesn't really have to exist. And the truth is that comes back to bite us in the end. And it's okay to feel really sad or really frustrated or upset, and to in a way kind of just take a moment and honor that. I think, for those of us who've been in therapy, we might have learned that the feeling that we have behind the avoidance is that we fear it might just take over our entire being, like a 2 or 3 year old, who's overcome with emotions and you're just overwhelmed and stay that way forever. And the truth is emotions will pass, and especially if you learn how to kind of feel them, process them, and there are lots of different really healthy ways to process those more kind of negative or scary emotions like sadness, fear, anger, and frustration.
And even if it is uncomfortable, I imagine there's some sort of natural release that happens if you're alone and just need to cry or just need to yell. Am I right in that mindset of thinking that there's just like a natural release of um, just a physical reaction that happens to do that in a healthy way?
Yeah. Yeah, that's right. I mean, just like, if you've ever heard about the experiments that show that just by exercising your facial muscles in terms of smiling, that it actually leads to an emotional state and a physical feeling. Well, the same thing is true. And emotions, hard emotions, and feeling them can definitely be cathartic. I think what happened for many of us is the layer of learning and socialization in our early lives taught some of us, especially boys and men, to believe that it was a sign of something else, like weakness or, a lack of strength. And that is absolutely not true. You know, I think some of the most sort of really evolved, wonderful male role models in our society right now, whether they be athletes or musicians, are actually talking about how it is to be a man and feel your full range of emotions and be able to express them in healthy ways. And I think about on the other side of things, if you're the partner of somebody who is penting up all their emotions and doesn't know how to process them, that creates real issues of lack of intimacy in a relationship and other kind of behavioral or health problems that come up because the individual hasn't learned how to do that. So it is absolutely a healthy thing. It's not only okay, it's a good thing to feel them. And again, you can use all sorts of things to process them, like writing, just feeling it, talking to someone you trust, and certainly in therapy. That's something that many of us, use therapy for lots of different reasons, including learning how to process through the hard feelings or feelings of conflict, uncertainty, fear, and so forth.
Well, you mentioned smiling, and I'm naturally smiling now and feel a little better. So hopefully, people watching kind of have that same effect. It's a contagious thing,
Yeah.
necessary thing for me today. So thanks. But what happens once we worked independently with ourselves, and that's kind of step one of coping, and the next part is reaching out. How do we make that transition to finding resources to do this and kind of bring someone else into the equation?
Yeah, it's a great question. And what I would say is, like, the very first thing is feel your emotions. Good thing. Next step is you get to use your brain and your mind now to make choices about your actions. So that's really more about that. We have our thinking brain is sort of overactive, for many of us at least. And there needs to be a balance of just feeling and being present and mindful, and then kicking our mind, our sort of big brain, into action. And there are so many different wonderful resources that you can find. If you're looking to start working through maybe even past trauma or anxiety that's overwhelming, if you're feeling that depression might be an issue for you now or has been in the past, now is a great time actually to look for telehealth services, to think about ways and options that you have available to you to work some of that through so that it doesn't have to be such an active force in your life. Certainly if you're facing a crisis, then the crisis text line, by texting the word TALK to 741-741, and the National Suicide Prevention Lifeline at 1-800-273-TALK. There's also a disaster hotline that is also a fantastic 24/7 resource right now, and is being highly utilized. All of those are ways to not only get your distress addressed in the moment that you're in, but also to learn about resources that are there for you moving forward in your life. I'll just mention one other resource, and it's a website called NowMattersNow.org. And it was designed and actually has been evaluated for its impact on people who are feeling all sorts of different types of distress. And so NowMattersNow.org is a great one to check out as well.
And when you mention telehealth, for someone who's never heard of that, how do you even go about accessing it? And what do you need? Does my insurance cover that? Do I have to have a certain plan for that? What if I don't have insurance? I mean, there's just kind of those general questions that come with healthcare in general, I think. And now this is just a new one we're introducing to some people.
Definitely. I mean, I would think about the way we've all learned to connect with each other socially. Well, the same thing has been happening for medicine and psychiatry and psychology. So for a long, long time, actually, we've had the ability to see our doctor for certain types of health issues via telehealth. And of course, with COVID and the need to, protect others and decrease contagion and all of that, what happened was the barriers that have been in the way, really, of people being able to access telehealth services, and also of medical and psychiatric, psychological providers being able to provide telehealth services, those laws rapidly got lifted and changed to facilitate people to be able to connect. So the first thing I would say is, if you have health insurance, that's definitely the first place to start, is to see if your health insurance benefits covers telehealth services. And if it doesn't, it's something that you could actually advocate for, because now they are so much more widely available. So you could, for example, if you were wondering if you're getting physically sick, but you don't want to go to an urgent care or an ER or to your primary care, you could actually have a video chat visit with your primary care provider. Well, and the same thing is true for mental health. And you can connect to a psychiatrist, psychologist, social worker, and receive an evaluation, therapy, and even medication treatment using that kind of online or video chat telehealth services. It's not only convenient, for us as patients, but it's been studied, and in many instances, it is just as effective as in-person and sort of traditional the way we've been getting our health care. So I really would encourage people to check it out. And if you've been thinking, do I need therapy? If you've been thinking about that for a long time, this is just an awesome moment to check it out and try to discover that for yourself.
And just as much as mental health is important, I think physical health just intertwines with all of that, and it just kind of is this balance of the two. So how do you make an effort to make sure you're being productive with getting the resources that you need for your mental health, but also that motivation to keep your body moving and keep, that groove going for you, maybe with at-home workouts or a run or something to make sure you're bringing that balance? It can be difficult in confined spaces to find that constant motivation to make sure you're being productive on both ends. So what's your advice for someone who's struggling to, think about it, but then put those into action?
Yeah, thanks. That's really excellent. Just remember, your brain and your body are connected. And so anything that you have found in the past that helps you to feel more centered, grounded, to sleep better at night, to feel more yourself and your best self, that might be exercise, that might be certain people, certain music, certain activities. There are, for all human beings, physical and mental health are connected, and the basics will really optimize both physical and mental health. And those basics are, as you were just alluding to, like getting enough rest. Make sure you protect your sleep. Try to have some structure to your day. Try to make a plan for yourself, because that feels good to most of us, to have that security of knowing what the day or the week is going to bring. But it's also a way to protect your sleep and your rest, because otherwise we might just kind of get into a very nebulous state of how when we're sleeping, when we're eating, when we're working, and so forth. So really kind of structuring it, and make sure that your nutrition is at least adequate enough. Limit your alcohol consumption. Try some new things like a brief, deep breathing exercise a couple of times a day is actually a way to physiologically center yourself and bring your mind to the same place where the center of your body is. And it actually can lower your heart rate and bring down anxiety and feelings of distress right away. But a long-term practice of that and other mindful practices is really helpful. And staying socially connected. I know some people, it's not as easy or come as naturally to want to get on a video chat or to connect with the people in your life. But now is a time when we need to actually be more intentional about doing that. And I guess the last thing I would say is, it doesn't have to be perfect. Like, all of this is a bit of a struggle for all of us. We're all in this together. It's okay if you're kind of learning as you're going. I would say the main thing is to just keep kind of paying attention to it. Reflect back on, how did the last few days go? What do I like about what happened there? What can I do to actually shift things a little more positively? And it might mean taking out your daily planner and scheduling some of those things in. For me, I have to get some exercise on a regular basis, or I really notice that my mood, my energy level, even my kind of mental fogginess starts kicking in. So, but each person, yourself best. So think about those things and scheduling them in.
I think, unfortunately, so many people, on top of handling this pandemic and watching everything unfold, is difficult. But at the same time, it's impacted lives drastically, from plans that have changed, trips that have been canceled, weddings that have been canceled. Maybe you just started a new job, or you moved to a new place. How do you deal with a sense of grief that you've had from everyday life situations that we were used to, on top of all of this that we're just kind of experiencing as a world? How do you take on that additional grief and still kind of prioritize what's impacting your daily life and your your family or your other, or things that were disrupted?
Yeah. It's a really, really good point. I think grief is something that many of us are, we're experiencing different kinds of losses right now. And for people who have lost a loved one to the coronavirus or have experienced significant other kinds of losses like employment, like financial security, and you mentioned, like all of those things that were on the docket that now have had to either be canceled or postponed, changed in some way. That kind of adapting to change is hard on everyone. If you are experiencing grief that is intense, there is a whole community of people who are also grieving or who have grieved. Their grief journey started long ago, let's put it that way. And so they're much farther along in their place of healing and of learning how the experience of loss and grief doesn't actually have an end point per se, but your loss and your experience of your life now without the one you loved or whatever it is that you're grieving, that becomes whole and integrated into your current life. So I would say, just try to gauge if you are grieving. It is something to pay attention to, and to, again, just like we were talking about earlier in terms of emotions and not just using denial, brush it under the rug, tends not to work out as well. We don't get to heal as well. We don't get to remain our whole selves, and our relationships remain as intact if we don't kind of go on a journey with that grief that just honors it and pays attention to it. And there are many different important grief resources, but I'd say the first thing to know is that there are people who've experienced loss who are part of a community who would want to support you, and there are ways to tap into that via grief support groups and other things. If you're interested in learning more about that, there are many different organizations that focus on that. We at the American Foundation for Suicide Prevention, we've had a dedicated focus to people who are bereaved by suicide loss, which is a very specific type of loss, obviously. But that loss community of bereaved people is incredibly strong and empowered because they've learned how to walk on this path and to do it together and connecting together with others.
One of our audience members asked a question that I think was interesting, and I wanted to run it by you. It was, if someone you know has a mental health crisis that would normally lead to hospitalization, let's say someone is suicidal or having a psychotic breakdown, do you not take them to the hospital right now, or what's your alternative solution to help them?
Yes. Okay. That's important. If the person is in the act of harming themselves, or is in imminent danger, that is a moment to call 911. Anything short of that, you can absolutely rely on the National Suicide Prevention Lifeline at 1-800-273-TALK. Even if you're the helping person, you don't have to be the person who's going through it, in distress. You can be the helping person and call them to get guidance about what the best next steps are. Hospitals are still operational, and inpatient psychiatric services are still going. So don't assume that you can't get help, but those are the first steps I would take. And of course it depends. Some people are very familiar with a local crisis center, psychiatric center, or emergency department, but for the most part, in most locations, I think it would be best to go with, like I said, reserving 911 for that acute imminent danger moment and relying on the National Suicide Prevention Lifeline for anything that's kind of, upstream from that moment.
And we have time for one more question. parallel to that is if we have friends who were relying on treatment for substance abuse or addiction, but may have lost their benefits, um, amid this pandemic, what are the suggestions for free or affordable resources for them to turn to?
Yeah, there are many virtual and online resources that are being messaged widely for anyone who struggles with addiction or substance use issues. Now is a really critical time because people are stressed, and we tend to be more isolated and in our homes, and so access to those substances may be higher, and the usual healthier ways of coping may be harder to come by. So it actually is a really critically important thing right now. I would point to two things. SAMHSA has a very reliable treatment finder link on their website. And if you're looking for that, you can go to SAMHSA's website, or you can go to afsp.org and put in the search function, find treatment, and you'll be linked to that treatment finder resource. And so you can be anywhere in the country and actually find a mental health provider or a substance use treatment center or provider. And the other resource I would mention are that many 12-step and other support groups for addiction have made themselves available via virtual support groups or sponsor relationships. And so again, there is no time like the present, and there's so many resources, and I think this is on so many people's minds. You are not alone, and now would be a great time to tap into those.
Well, I certainly appreciate you connecting with me virtually to have these conversations. And I want to encourage anybody who's watching to send their questions in on behalf of their friends or family, or even themselves, and continue this dialogue. I know that you and I will try to continue this on a weekly basis. And I just appreciate you encouraging an open door to these conversations that all of us are feeling to some extent. It's just so important, and really, really refreshing to have this conversation.
Thanks, Jackie. It was great talking to you as well.
And we'll talk again next week.
Sounds great.